Week, so some of these questions are more to help you review what you already did. We got Mr. Helms, old guy, heart problems, doctor. So question 1 we did last week, and you did on your quiz. You would do the flow. So we're going to skip question 1 and go to question 2. What is the function of a heart valve?
Prevent backflow.
Prevent backflow. Stop blood from going backwards. To keep blood going the right way. Pick a word you like to use. But they're stopping backflow. Prevent reversing. And when I plagiarized this, I forgot to include the information for number 3. So we're going to skip number 3 because there's not enough information in the case. Next year I'll rewrite it. But we're going to go down to number 4 then. What would a valve problem cause to happen to your stroke volume? So blood output. If you have valve problems, would you get more blood or less blood out of your heart? Less blood. So let's talk about that. That's called a murmur. So if you have a murmur, the valves don't close correctly. So if you have a murmur in your heart, the doctor notices the valves aren't shutting all the way. And so you would get more backflow, which will reduce the blood leaving your heart, because it's going to go backwards. So that reduces output. Does that make sense? If the blood just goes in reverse, it's not coming out. Okay? So now that leads us to number 5. Mr. Helm has a higher heart rate. Why is that?
Not die.
Very good. Let's say negative feedback and scream real loud. All right. So if I'm going to keep me alive, if I have less blood going out, I'm going to have to pump more often. Does that make sense? Okay, so we're going to learn some math tonight. We're going to do the math of the output of your heart. So there's 2 factors for your output, which I'll show you an animation for. Choice 1 is your heart rate. So heart rate is one thing that affects your output. How do you measure heart rate, E? Beats per minute pulse, right? So how often my heart beats is one factor of the output. The next choice is the volume of blood. Those 2 things combined tell me how much my heart is doing, how many times it's beating, and how much blood it's ejecting. So if I'm getting less blood out, I have to compensate by increasing the number of times I beat. Does that make sense? If I want the same amount of blood leaving my heart. Likewise, if I get more blood out, I can turn down my rate. Does that make sense? So your heart is going to try to compensate each of these for the other one. So I'm going to control rate and volume using my heart and negative feedback. So I'm going to show you an animation of this concept between 4 and 5 of less volume and more rate. So I'm going to show you some animations.
How are you able to measure the volume?
Good question. I'll show you that. It's all math. Unless you do human sacrifice, then you don't have to. Okay, so we're going to do cardiac output, which is a measure of your heart pumping blood out. All right? Okay, so there's a math that you don't have to, I'm never going to ask you on a test to calculate this. Okay, so don't math phobe me. But you have to understand the concept here. That the output, the amount of work my heart is doing, is based upon how fast it beats and the stroke volume, which is how much blood it ejects. If you know bore and stroke for a car, that's the logic. Right? So how fast it beats and how much blood combined tell me how much work my heart is performing. Make sense? Okay. So how do you measure heart rate? Yeah, right? Count the beats, count the pulse. Okay. So you're going to sit here and go crazy, but you average 75. But if I count your heartbeat for a minute, I'm getting how many times it ejected blood. Make sense? Okay, that person died. Stroke volume. That's what it's measuring, is the stroke volume, or the amount of blood ejected per ventricle per beat. So in this case, it averages about 70. Right? So if I do the math, if I know how many times you're beating and how much blood you get for each beat, I can calculate how much blood per minute you're going to eject. Make sense? So if I affect one, I can affect the other. So how do they measure this, you ask? Glad you asked. Hopefully. It's basically mathematical. You have to measure the heart expanded and contracted. So you take EDV, ESV, and subtract them. Because in a real person, you can't do this unless you want to do this. So you could take someone's heart out and have it squirt into a beaker, make your little brother rip his heart out, and then catch the blood. And if I did that for a minute, I would know how much output your heart has. So I have 75 beats a minute. I'm ejecting 70 milliliters roughly per beat. I do the math. Anyone know what the actual number is going to be for an average cardiac output for the average patient? I'm not going to ask you in a test, but it's a good number to sort of keep in your head. Well, we're a little over halfway. You can take 75 times 70, you get it kind of fast. Anyone want to go 4,000? How about 5,000? Look at me, 5. Look at me, 5. Closer.
7.
It's
6.5.
42.50.
Yeah! All right. So worthless, you know, you don't have to know this for a test, but you pump roughly 5 liters a minute, right? So if you think about that, at the grocery store, that's basically 3 2-liter bottles every minute going through your heart, roughly. If you figure you only have about 7 liters of blood, that's over half in a minute, right? So you figure if a doctor ever nicks your arteries in surgery, there's a lot of blood on the floor in a minute, right? Because your heart would just pump it up. But this is the output, so I'm measuring how much blood my heart can eject. Right? So we're going back to Mr. Helms and trying to figure out what happened. So here's the page we're going to focus on. Factors affecting output. So we have heart rate over here, stroke volume here, total output over there. So we're going to manipulate those numbers. So let's do sympathetic stimulation. If I give you more sympathetic stimulation, what do you think is going to happen to output? It's going to increase, because sympathetic, remember, your heart beats faster, it beats harder, which means it ejects more, which should raise stroke volume. So if we do that, math, indeed. So in sympathetic innervation, I beat faster, I beat harder, contractility, I squeeze more, getting more blood out, thereby getting increased output. Your heart beats, thumps out of your chest, right? So why would you want more output sympathetically?
If you're working out or
Working out, fight or flight, right? Someone's attacking me, I want all the blood moving I can. So if I give you parasympathetic, what do you think will happen in these numbers?
Reduce.
You sure?
Yeah.
Positive? I hope so. Right? Part of white coat syndrome, right? So you calm yourself, all the numbers drop back to normal. Right? I beat less often, I beat less blood, therefore I get less output. So I'm going to make you exercise. What do you think will happen if I exercise to output?
Increase.
Sure?
Yeah.
I think so. Exercise is stress, does the same thing. You beat faster, you beat harder, getting more blood out to your muscles. Right? Okay, so now we're going to do Mr. Helms. Mr. Helms had a problem with his backflow, right? So he ended up with this. What do you notice on that graph there? What happened?
pumps so fast it can't fill up.
As heart rate goes up, stroke volume goes down, keeping me at the same number. So if I have less volume, the only way I can keep normal flow is to crank up heart rate. Likewise, if I increase my heart rate alone, my stroke volume goes down. Why would increasing heart rate make your stroke volume go down?
Less time to fill up.
Say it loud, own it.
Less time to fill
Less
up.
time to fill. Remember Starling's law, right? If I beat faster, that doesn't give me a lot of time to fill my heart. So EMTs, that's back at VTAC, right? Your heart's beating so fast, you're not getting anything. Yes?
How is that different than exercise on your heart rate?
So in exercise, you are beating faster, but also you're increasing contractility, which forces the heart to actually squeeze harder. So you get a better ejection, plus you're getting venous return. So you are, if you didn't have the contractility, it would go down. But because you're actually beating harder, you're squeezing more. You're getting more ejection with less fill. In this case, I'm simply beating faster, and thereby I get less volume being pumped out, keeping me the output. So Mr. Helms, he's losing volume, therefore his heart has to beat faster to keep you normal. Make sense? You're trading. So if you understood that, if I slow your heart rate down, what should stroke volume do?
Increase.
Boom. So if I can slow your heart down, you get increased stroke volume, or if I can increase stroke volume, my heart can beat slower. Does that make sense? Okay, Lance Armstrong, before his embarrassing debacle and fall from glory, not that I'm jealous of the man, he claims his resting heart rate is 32. He claims a lot of stuff. Okay, my resting heart rate is 68. So he's claiming his heart is half the speed mine is. And by extension, what's he claiming about his stroke volume then?
Twice.
He's pumping twice the blood. Because if he halves his heart rate, this would have to double to make the same value there. So he's pumping twice the blood per beat that I am, so he claims. Therefore, his heart's beating half the time that mine is. Right? So if your resting heart rate is like 150, you're pumping 150 times with 150, less blood each time to make the same amount. So the analogy you want here is driving your car up the freeway. This person's driving in first gear. They're revving up their heart as fast as they can, getting very little distance to go 55. This person is in overdrive. Their car's barely over idle, and they're still able to go 55. Which of those is going to wear out your heart faster? Slow heartbeat or fast heartbeat?
Fast.
Right, so that's why in gym class they take your pulse. The idea is if your pulse is really, really fast, you become less efficient. You're pumping less blood each time, thereby getting more work for less output. Lance Armstrong is claiming he's more efficient. He can pump the same amount of blood with half the time, thereby doing half the work, half the valves, half the contractions, half the work, because he's great. He makes lots of money. Not that I'm jealous, right? Yes?
Don't endurance athletes, like after a certain amount of training, actually change their, don't they slow their heart rate to
Yes.
some degree, especially during cardiovascular exertion?
Right, so the argument is if your heart's slower than everyone else, that's because you're better at pumping the blood. Your heart's more efficient. Your heart actually is increasing its volume.
But you don't think anyone could get it to be half?
Well, I don't believe him, but the idea is if I measure your heart rate, stroke volume has to be the opposite. So if your heart rate's dropping, it means you're pumping more blood each time, which means your heart's doing more work with less beats. So exercise should cause me to lower my pulse rate over time, because my heart's getting better at pumping blood. Yeah.
Is that only in an ideal situation, or if there was a problem, would it still be the same?
Yes.
Okay.
So your heart doesn't know why you're
It's
pumping
pumping
more or
less.
less. It
Okay.
just responds. Right? Make sense? So we go back to Mr. Helms. Right? Why is his heart beating faster? Because his stroke volume is going down. Likewise, if one goes down, the other goes up. So we can put that on the board. So an increase in that heart rate is usually a decrease in stroke volume under normal circumstances. They're opposites. So since I'm losing stroke volume, I have to speed up my heart to keep the same amount of blood going. So I'm not as efficient as Lance Armstrong. I knew that. All right? Make sense? So he has to pump more often because he's getting less blood through the heart if he wants to stay alive. So let's go through this one. Here's wife says he's having a heart attack. So left side of the heart receives blood from what?
Lungs.
The lungs, the pulmonary circuit. Very good. If you remember our picture right here, the left side's receiving blood from the pulmonary veins, from the pulmonary circuit. Okay? Make sense? So now, let's say it's this bicuspid or mitral valve that's not closing. What's going to happen to his pulmonary circulation if the bicuspid doesn't close? Think about this here, and what will happen to his pulmonary system if the bicuspid doesn't close?
Back up.
It'll back up. Very good. Let's look at that picture one more time. Very good. The bicuspid's on your left side. So if that's leaking, blood's going to go backwards up my what? Pulmonary system, and it's going to back up into my lungs. It's not going to leave the heart. It's going to stay in the pulmonary system. Does that make sense? Mm-hmm. You're not going to eject it. So therefore, your pulmonary circulation would be going up. You'd get more blood in the pulmonary system. right? That's right. So then what's going to happen to the blood pressure in his pulmonary system if the blood's not leaving?
Increase.
It should go up, right? He's going to have more fluid in his pulmonary system. So tell me why the nurse heard crackling wet crud when he breathed. Where's that coming from? The fluid from the bloodstream. You're getting more fluid in the lungs because it's not leaving. So you have to remember the goal of the heart is to eject the blood out. Blood's backing up like your sewer in your house. It ends up everywhere, right? So my lungs get full of fluid because the fluid's not leaving my lungs. That makes sense? Pulmonary edema, congestive heart failure, those things. Right? So the fluid's not going out, so it just stays where you put it. Make sense? So heart diseases will affect your pulmonary system because the blood can't move. Right? So, Mr. Helms, we're going to do a bunch of stuff. They're going to give him pills, of course. We've already covered this, but this will be a good review for your final exam someday. Tell me what agonists and antagonists do. Agonists do what? Increase the same, contribute to, same as. Antagonists do what? Stop, block, turn off, remove. So notice we have things that are antagonistic and things that are agonistic, right? Things turn off, things turn on. So notice we have some betas and some alphas. So let's review. Which system uses alphas and betas? The sympathetic nervous system. Very good. Which system uses only choline, like nicotinic or muscarinic? Parasympathetic. So depending on which drug you pick, you can turn on and off the sympathetic or on and off the parasympathetic system, which we covered, about 3 weeks ago? So future nurses, here's the doctor's order. I want a receptor antagonist to reduce his heart workload. Look at the chart. Tell me which of those would be the best choice for receptor antagonist to reduce output.
Beta 2 block or beta 2 agonist.
Doctor ordered an antagonist, so he just fired you because he ordered this one. So doctor orders an antagonist. You don't get to choose an agonist. Beta 1 blocker. In fact, we just had a group talk about that, right? So a beta 1 blocker would turn off his heart and keep his heart from speeding up, thereby lowering the pulse. Right?
What was 11 again?
Which one?
11
was sympathetic.
Oh,
Does that make sense? So the doctor's going to pick from that list what I want your heart to do. I want to turn off your sympathetic system and reduce your pulse rate. And look at this. Lowering his pulse rate increased his output. Why would that happen?
Because they're opposite.
I can have a chance to fill. So if I go fast, remember I'm lowering my volume. So if I can slow this down, I can get some more blood to come out. Make sense? That's using the cardiac output concept. So you can control the output with your heart rate or volume, or both. Make sense? Cool. So now we're going to learn the next thing we're going to do, which is back to the output animation. There's one we didn't do yet. Actually, several. I'm going to click this one right here. Increased venous return. Can someone tell me in English what increased venous return means?
More blood in the heart.
Yeah, more blood back to the heart.
More blood back to the heart. Venous means veins. So more blood back to my heart. So what should happen to my output if I get more blood back to my heart?
Increase.
So if my heart rate stays the same, assuming, I get more blood back, more blood out. Right? So here's the question. How do I get increased venous return? That's my job. All right. To understand that, you have to understand what makes veins different from arteries. So, okay, here's a picture. There's an artery on the left. It's a vein on the right. I want you to look at those pictures. You're going to tell me 2 differences you see between the artery on the left and the vein on the right. There are 2. What's one of them?
Valves.
Valve. Who has valves?
Veins.
Ah! Veins have valves. Okay, one difference. Give me another one. What about muscle? Arteries have more muscle, right? They're thicker. So why would an artery need to be thicker, but a vein needs a valve?
Because there's more pressure going through the arteries.
There's more pressure in arteries, right? So arteries are away from the heart, full pressure. Fire hoses have to be thicker than garden hoses, so they need more thickness, more muscle, to handle the pressure. So veins should be thinner because there's less pressure. Explain to me the valve. Why don't arteries have valves?
Because they've got enough pressure to keep things flowing one way.
There you go, they got enough pressure. So why would a vein need a valve then?
No, it doesn't make
It's
sense.
fighting
Not as
against
much
gravity.
because veins stop backflow, right? So let me just walk you through blood pressure to understand this vein valve thing. So we're going to go down to this graph. It was hard to see. This graph is showing the pressure, the force in your blood. Okay, remember 120/80 is the usual. So here's my heart. Here's aorta. What's happening to the pressure as I go through the body? Starts going down. Why would it go down?
It's further away from the heart.
Further away from the heart. You're increasing the amount of tubes, right? Surface area goes up. Go home and hook 15 garden hoses together, and you'll notice that you're losing pressure as you go down, right? So as I go through my body, my pressure begins to drop. The blood force begins to drop. So look at the veins. How much pressure is in the veins?
Hardly anything.
Almost none. So that means why they're thinner, right? They don't have any pressure. Arteries have more. But I still doesn't explain the valve thing. So why would the valves be necessary if you don't have pressure? Prevent backflow. Why would there be backflow in a vein, but not an artery?
There's not enough pressure.
Okay, very good. Look at this picture. Those are your legs, not anatomically. Your butt's about here, your head's somewhere up there. Okay? So these are veins. So there's no pressure in a vein because it's after all the body. And so where would blood want to go if there's no pressure? Down. Where's down in that picture? Like your feet, right? Your legs. So gravity would want to pull the blood away from your heart. That's not very good. So let's look at the valves. What are the valves doing? Stopping backflow, keeping it from going in reverse. So the valves are there to counteract gravity's pull because there's no pressure. So gravity wants to pull them down, those stop them from going down, right? So because veins don't have pressure, we have to use valves to keep the blood moving, right? Just like that. Make sense? So now I want to use this concept to get more blood to my heart. What would I have to do to get more blood to move up to my heart?
More pressure?
I'd have to push it. How do I push the blood if there's no pressure?
Muscle contractions, skeletal.
Yeah, let's do that. Say hello to toothpaste. Right? When you squeeze the tube, the toothpaste has to come out because it can't go backwards. Same thing here. The valves prevent backflow. So every time you squeeze your muscles, the blood has to go to your heart because you can't go back. The valves keep it going one way, right? So every time I move my legs, move my body, I'm squeezing my blood toward my heart, also known as venous return, or muscular pump of venous return.
When you're in a hospital bed,
Yes,
they put those pressure things
Uh-huh.
on your legs. Is that what that
that's
is?
exactly right. The special stockings at the nursing home, that little machine that rubs on their legs, all that, that's this. If you're not squeezing your lower body, the blood doesn't get back to your heart because there's no pressure to move it. So I have to squeeze my legs, squeeze my abdomen, squeeze my body to get it going.
I have
Okay.
a friend that has a clotting disorder,
You do, you
and
do.
the doctor said that she's lucky she fidgets as much as she does, because it's probably helped her a lot.
Yes.
She's constantly bouncing her leg or something.
That's a good thing.
Yeah.
Ever fly coach class? Coach class syndrome, right? I'm too cheap to buy a good ticket, so I sit in the middle one with big people on each side, can't move for 8 hours. What do you notice with your feet at the end of the flight?
Very swollen.
They're swollen and your legs feel crummy because you haven't been moving. So all the blood that's being sent to my legs just sits here somewhere and doesn't go back to my heart. So what would happen to my venous return if I'm not moving on the
Go
plane?
down.
It's going to go down, right? That's why you get clots and all that. So what did they tell you to do on the plane? What are you supposed to do? Yeah, somehow magically get up and walk around, right? Which never works in the little plane. That's the logic. If you're moving around, I'm going to squeeze more blood, right? So let's go back to our little cardiac output. So if I move my legs, if I wiggle around, move my muscles, I'm going to increase venous return to my heart, which should then cause me to get more output because I'm getting more blood getting sent back. Does that make sense? So that's why at the nursing home, you're either moving the patient or you're putting the special socks on with a little machine so they can get their output up without having to raise their heart rate. Right? I'm trying to stretch the heart more by moving the blood. Make sense? All right. So let's do a little slight detour. Let's talk about varicose veins for a brief second. So tell me what happens when you have varicose veins.
Blood's pooling
Blood's pooling where?
in the vein.
In your legs, right? Can you tell me now why it's pulling at your legs?
It's not going anywhere.
You busted your valves, right? So if you break your valves, the blood's just going to slide down your leg by gravity. That's called varicosity. You've lost the valving. That felt great. There's varicosity, right? So varicose veins and all those things are because you can't get the blood anymore to move to your heart. It pools lower body, right? That's the idea. Yes?
How do you bust your valves?
Standing in one place, usually in bad shoes for a long period of time. Because what happens is, if you're not moving, you have all this weight of the blood column sitting on the valves, and eventually they'll snap off and the blood goes down. So because you're not moving, the blood isn't actually moving anywhere. Yes?
Why is it common in pregnant women?
Because you got a baby keeping the blood from going up to you. The baby's in the way. So the blood stays pooling, more force in the valves, gravity pulls it down. Right. So someone's head's there. That's the idea. Right. Make sense? So when you're working your nursing shift on your feet all day long, make sure you're moving. So you stand there in an office job or even sitting in an office job. You're not moving your legs. So truck drivers get varicose veins because they're not moving out of the seat. They're just moving a pedal on the semi. Right? And students who sit for 2 hours while some teacher talks. Make sense? That's it. So I can see all of you now wiggling, right? Okay, that's the why veins have the valves, because the low pressure, you have to do something. All right, so let's talk about blood pressure, since we're on this topic. Let's actually measure blood pressure. Okay, so in lab, 2 weeks from now, you're going to do blood pressure on each other as part of your experience. So you've probably done this, right? Okay, what happened to his arm?
Stop the
Stop the
vein.
blood flow.
The blood can't go through. Why can't the blood go through?
Because you constrict.
Because I'm stronger than the heart, right? So when you're squeezing the cuff, your cuff is stronger than his heart. So the blood doesn't go, right? Then you pop the valve, the sounds of Kudakov kick in. So those sounds when the heart can overcome the cuff, right? So you're stronger than the heart. That's why you have to release the cuff eventually, right? And then now the heart can start blasting through the cuff, and that makes a noise. Then why don't you hear anything there?
Because it's not pushing against the cuff anymore.
That's right. The heart is no longer pushing against the cuff. The cuff and the heart are now the same. So there's no difference in the pressures. Right? So when you do that on the gauge, right? So you heard the sound at first. What do we call it when you first hear the sound? The heart's squeezing.
Systolic.
That's the systolic. And when the sound goes away, the heart's resting. So diastolic, that's those words again. So you're measuring the heart's squeezing the blood through the cuff, and the heart's basically relaxed even with the cuff. 120/80, right? So that's how you're going to check the pressure. Now the hard part is not that, but what affects the pressure. So what would make my pressure change? So we're going to do a little case study and walk through that. So find the next page for me. It's the last case study we're doing today. Find page 26.
Ted Ho.
TED hose. How does the TED hose, how does that work?
The compression stockings.
Compression
They
stuff?
basically squeeze your leg. They make the veins smaller in the leg. They're forcing the blood to,
Forcing the blood.
like toothpaste, you're squeezing the leg harder.
Gotcha.
You can do the same thing just by shoving someone's leg. If you want to massage.
I dealt with those.
Yeah, stretch that. Okay, you have 1 minute as future healthcare professionals to read this and try to figure out number one. What the diagnosis of this man should be and what the normal value should be for whatever is wrong with him. I think you can figure it out usually about